Hi, my name is Dr. Karen Danvers Perez, and today's NCLEX question is brought to you by Danvers Nursing Institute. So let's get into it. The question reads, following change of shift report on an orthopedic unit, which client should the nurse see first? So this tells us that it's a priority question which comes underneath management of care. A, 16-year-old who had an open reduction of a fractured wrist 10 hours ago, a 20-year-old in skeleton traction for 2 weeks since a motorcycle accident, a 72-year-old recovering from surgery after a hip replacement 2 hours ago, and D, a 75-year-old who is in skin traction prior to planned hip pinning surgery. So a couple of things that we'll look at in this question. We'll look at the age. So we see we have our 16-year-old or 20, 72, 75. And you know, the older the person going into surgery, the higher the risk. But there are other factors that should be taken into consideration. And that's the type of surgery they have plus the hours. So let's look at this. This person had been out of our surgery 10 hours ago. So okay, we'll keep that person. I'm going to look at who else have recently come out of surgery. So for a 20-year-old, he had skeleton traction 2 weeks ago. So that's been a while. Let's look at the 72-year-old that came out of surgery 2 hours ago. So that's recent. And the 75-year-old is waiting for surgery, but because the person is older, there's other things that could be taking place, or risk factors, cognitive and even physical wise, being in the skin traction. So the answer would be C, the 72-year-old, because that person is recently coming from surgery, and there's some post-operative, there's some complication that could occur post-operatively. This person is at risk for bleeding. This person at risk for atelectasis or respiratory distress because you're just coming out of surgery. So C would be your answer. So let's look at the rationale. Look for the client who has the most imminent risks and acute vulnerability. The client who returned from surgery 2 hours ago is at risk for life-threatening hemorrhage and should be seen first. The 16-year-old should be seen next because it is still the first post-operative day. The 75-year-old is a potential vulnerable to age-related physical and cognitive consequences. In skin traction should be seen next. The client who can safely be seen last is a 20-year-old who is 2 weeks post-op. Thank you so much for watching this video, which was brought to you by Danvers Nursing Institute, where all your nursing educational needs will be met. Thank you.